Just last week, NFL player Foster Moreau announced that he was diagnosed with Hodgkin's lymphoma. He actually didn't have any symptoms, at least not that he was aware of. The way that it was discovered was actually during a routine physical exam by the medical staff of the New Orleans Saints. But this video is not so much about Foster Moreau as much as it is about a patient I had and the warning signs of lymphoma that were ignored. Let's face it, it's easy to brush off symptoms that seem relatively unconcerning. I can't tell you how many times I've seen men who come to the hospital only because their wife bade them come. But yeah, it can be easy to brush off the red flag symptoms, let alone the less concerning ones. Now, my patient, let's call him Bob, who I first met at 3 in the morning, when he was being wheeled into the intensive care unit because he was minutes, if not seconds, away from dying. Well, he was in his mid-20s, and you can imagine what his parents were thinking at the time, and his girlfriend, of course, all very concerned and wondering, how did he go from being seemingly healthy just a couple months ago to this? Lymphoma is a type of cancer that starts in white blood cells of the immune system, specifically the lymphocytes located throughout the body's lymphatic system. There's two main types of lymphoma. 10% of cases are Hodgkin's lymphoma, and the rest being non-Hodgkin's lymphoma. The exact causes of lymphoma are not well understood, but some risk factors have been identified, such as a compromised immune system, certain infections, for example, the Epstein-Barr virus, that's what causes mono, and then also a family history of lymphoma, and exposure to specific chemicals and radiation. Hodgkin's lymphoma is most common among young adults, aged 20 to 34, and is slightly more likely to occur in men. Bob did not have any known risk factors. He was healthy, he worked out a lot, but then he starts feeling more tired than usual. He thought nothing of it at first. And then a week later, he has a little bit of a fever, and his girlfriend thought it was weird that his pillow and the bed sheets were soaking wet during the night. So now his girlfriend drags him to the urgent care clinic. He stands on the scale and thought it was a little odd that he's now weighing 180 pounds because the last time he weighed himself a couple months prior, he was 190. The doctor comes in the room, notices some swollen lymph nodes in the neck when he's examining him, chalks it up to
most likely a viral infection,
but tells Bob to
come back in a few weeks if things aren't better.
Not every patient with lymphoma is going to develop all the warning signs, but persistent tiredness and lack of energy, even with adequate sleep, is definitely a common symptom with lymphoma. There's a million reasons why someone could have fatigue, but it becomes especially concerning when it's a new symptom and when it's accompanied with other symptoms. Fatigue in lymphoma patients is often due to anemia resulting from the cancerous cells crowding out the healthy red blood cells in the bone marrow. Unexplained persistent fever can also be a sign of lymphoma. Fever in lymphoma patients is usually due to the immune system's reaction to the cancerous cells and the subsequent release of certain molecules into the bloodstream like interleukins and cytokines. Heavy night sweats, often to the point of soaking through the bedclothes or bed sheets, is very common with many types of infections, but it's also a fairly common symptom of lymphoma. These sweats can result from the body's ramping up of the immune response to the cancer. Rapid, unexplained weight loss of 10% or more of your body weight within 6 months can be a sign of many things, including cancer, and of course that includes lymphoma. Now, this weight loss can occur due to the body's increased energy expenditure to fight off the cancer and or because of decreased appetite. Now, 40% of patients with Hodgkin's lymphoma present with the classic B symptoms, meaning fever, night sweats, or unintended weight loss. One of the earliest and most common signs of lymphoma is painless swelling of the lymph nodes in the neck, armpits, or groin. The neck is the most common site of involvement, as 2/3 of patients have enlarged cervical and or supraclavicular lymph nodes. Now, lymph nodes that contain cancer in them, they're usually non-tender and have a firm, rubbery consistency. Swollen lymph nodes or enlarged lymph nodes can also be caused by infections. Persistent swelling without any other signs of infection become more concerning for cancer, especially if they're not tender. Bob did not have this warning sign, which is pruritus. So itchy skin, it only occurs in 15% of patients, but if it does occur, it's usually the first clue to the diagnosis, as it can occur several months to a year before the diagnosis of Hodgkin's lymphoma is made. The itchy skin, it's typically generalized throughout the body and tends to cause lots of scratching. This intense itching results from the release of specific chemicals by the cancer cells, which causes irritation and inflammation of the skin. Sometimes there's other signs and symptoms depending on the exact location of the lymphoma and how far advanced it is. For example, sometimes lymphoma in the chest can grow so large to the point of impacting vital structures inside the chest, and this can lead to chest pain, cough, and difficulty breathing. So, what about Bob? Well, about a week after he went to the urgent care clinic, he starts feeling short of breath, and this gets worse and worse to the point that his girlfriend brings him to the ER. Now, the ER nurses, they recognize that this guy is in trouble as his heart rate is fast, blood pressure is low, and his oxygen levels are dropping. Bob's girlfriend starts getting really worried, especially after the ER doctor sees his chest x-ray and tells her that there's fluid around his heart and we need to move him quickly to get him to the intensive care unit. Now, normally a pericardial effusion by itself is not an emergency, but sometimes if this fluid around the heart develops very quickly, it can start compressing the chambers of the heart, and this is called cardiac tamponade. And by the time Bob was being wheeled out of the ER, his heart was shutting down. Thankfully, we were able to stabilize him after we intubated him. We put a breathing tube down and we had him on the ventilator. And then the interventional cardiologist, he came by and drained that pericardial effusion, and that relieved the pressure on the chambers of the heart. Eventually, he has a lymph node biopsy done, which involves removing a small sample of tissue from the affected lymph node and then examining it underneath the microscope, and that confirmed the diagnosis of Hodgkin's lymphoma. After his treatment, he has a dramatic improvement and was able to leave the hospital. The prognosis for lymphoma, it varies depending on the type, the stage, and the patient's overall health. Generally, early detection and treatment leads to better outcomes. The survival rate for Hodgkin's lymphoma is relatively high, with a 5-year survival rate of about 90%. Non-Hodgkin's lymphoma has a more varied prognosis with a 5-year survival rate ranging from 60 to 90% depending on the subtype and the stage. There's no surefire way to prevent lymphoma, but adopting a healthy lifestyle can at least help to reduce the risk. So this is doing things like maintaining a healthy weight, exercising, eating healthy, and avoiding exposure to harmful chemicals and radiation.